All right, so another thing to think about is what kind of visit do you want? How long do you want to be with your practitioner? So some chiropractic offices are built on a very strictly volume model. They see 80 to 100 or more people per day. So it's very much transactional in and out of the office. You're in, it'll be very standardized. You'll go to one room, maybe like a hot pack or a little bit of, we'll call it therapies, right? A little bit of modalities. And then it's, bang, bang, rat crack, 5 to 7 minutes, and then you're out the door in probably no more than 10 to 15 minutes total for the appointment. So you really don't have the time to ask a lot of questions and really kind of dig down and get more answers. You definitely won't have time for any kind of restorative or rehabilitative exercises that can teach you. And that's okay. Like, that's that model. It's not what we do, but you have to think to yourself, what do I want? Do I want a very quick, convenient in and out that I won't have a plan for home, right? Or do I want something that I can ask more questions, I can take more time and really get a little bit deeper into the process. Also think about, what would you like to get back to doing? I mean, ultimately, what is the goal? I know that you'll say right away the goal is to reduce pain or get out of pain. And that's only the temporary or the first part of the goal. Because really, if pain was the only thing you were after, you could just give yourself a shot of morphine or take some very strong but not good for you drugs, and that would take the pain away. But that's not what you want. Most people don't want that. They want an actual solution. And it's not because just that it hurts. Yes, that's not fun, and pain is not fun to deal with. But it's because the pain is stopping you from doing something that you want to do, right? It's keeping you away from an activity, maybe a feeling like I like to go work out, I like to be active. So if I couldn't do those things because of pain, that's what I really want. It's not that I just want the pain to go away. I want the pain to go away so that I can do something else. So think about that. What kind of clinic is going to help you? One, right? That's the first part. Yes, I feel better. But then two, will they help me transition and go from that repairing phase of kind of getting things calmed down to teaching me how to move better, how to incorporate different kinds of exercise and movements back into my life, how to gain the confidence back into those movements and take me through that path, right, all the way to where I'm back to doing my activities and I feel good about it. I don't feel fearful, because really that's what a lot of people feel is fear of movement or fear of making something worse, right? I want to try something, I know I need to do something, but I don't know what to do, so I'll either do nothing, which is the most common response, or I don't want to do this. I don't want to do the wrong thing for fear of making myself worse. So pick a place that's going to help you get through those stages, as opposed to just, I'm in 5-6 visits, the pain has gone from a 7 to a 2, and they kick me out. That's one option, right? That you can do that. But once it goes down to that 2, the chances that it goes back to that 7 within a few days or a few weeks is quite high, because you never actually got the problem fully resolved and your body restored and the tissues able to tolerate the loads of those activities again. And so you'll quickly be back into that 7, 8 out of 10 pain. I also want you to think about physical therapy or chiropractic or any treatment as, not just a commodity. So do you feel or believe that these ways of helping me are just commodities? So as long as I pick the lowest cost one, they're all the same. Or do you value the outcome and your overall health and the relationship that you build with the person and the clinician and the business? Do you value that more than just the price? Because those are two different things. If you just value price, then yes, you should pick the lowest cost one, and it may be good, it may be bad, it just depends. But if that's what you feel is that they're all the same, it doesn't matter where I go, then the lowest cost one's probably going to be the option for you. But if you believe that, no, like I actually am more concerned with my overall health, my overall outcome of the process, I want to feel like I had a good value and that I was taken care of and that I was listened to, and that I have a relationship built for the future, that if something does happen, I can always go to them. they'll help me along any path or any problem that I have, then that's a different kind of clinic. It's a different kind of clinician even. So are you value driven or are you price driven? That's something that you have to decide for yourself. All right, so as we get into this, there's a couple of the things I wanted to mention. A couple of them have to do with just the style of treatment as well. What kind of person are you? How accountable are you to yourself? So accountability is another thing that you could look for and say, hey, I know that I need to do this, and I will do it at home if someone just teaches me how, right, and guides me. Or are you someone who says, no, I know, and you should know yourself, I know that I won't do it unless I come into the clinic and someone takes me through and shows me, okay, Jim, Sally, get on the table or go to that machine and do, 10 reps of this, 12 reps of that. So what, do you need someone to be there, like physically with you and guiding you through? That's one kind of, service. Or do you have the accountability and the self independence to say, well, I know that I will do it to help myself. I just don't know what to do, so I need some help. So that's one thing to look at. The other one is passive versus active treatments. So some clinics will predominantly do passive modalities, meaning heat, ice, e-stim, ultrasound, passive stretches, where somebody is doing something to you. And so then you build this relationship of reliability of saying, well, I need that person to do that thing in order to feel better. Where I'm just getting passive modalities and it feels better at the time, but then I don't know what to do when I get home because I always have to go in to have them do those things. It's a machine, it's a special technique, something where it's more passive, as opposed to an active treatment is more along the lines of working with somebody that can teach you how to move properly, right? They're going to use therapeutic activities. These are just kind of some of the words that we use: therapeutic activities, therapeutic exercises, which just means, again, specific activities, exercises, movements that you will learn how to do to be more self-aware and more self-independent, and then you can continue those at home. Along with, like when you're there, some specific treatments, manual therapy type techniques and movements, and maybe even some occasional modalities and specific or special machines. But at least there's some form of active therapy where you're having to do something to help yourself, as opposed to I'm just going in completely passive. For instance, not that it's not better or worse or right or wrong, but massage in general is a passive treatment. It feels good. I like it when I'm there, but then I have to keep going back. How long does it last? I feel better for a few days, maybe a week, and then I got to just keep scheduling and going over and over again. Versus the massage or some kind of technique along with something active, a stretch, a movement, an exercise, a program that I can continue at home to help the results or the benefit of the treatment last longer. That's two different things. I also want you to think about how soon someone can get you in for treatment, right? So if you're currently actively in pain, something happened, I had an injury, and you call a place and say, yeah, we'll get you in 2 weeks, 4 weeks, 6. Some of the orthopedic places, doctors and certain physician offices, sometimes 4 to 6 weeks. Even some PT or chiro clinics can't get you in for 2 or 3 weeks. If you're actively in pain and having an issue, waiting that amount of time with no clue of what to do, so I'm fearful that I'm really hurt. Something is happening here. I need to get this thing fixed. I'm scared, right? So I don't know, am I going to get worse? I'm confused. I don't know what I should do. And so that time frame of waiting is not a good plan. It's not a good option to just sit there and wait, because no one's coming to save you. You have to find a place or some place that can fit you in, that can rearrange a schedule. Ask them, can you come in early in the morning? Can you come in before you open? Can you stay late? Can you see me over your lunch hour? The places that truly care about you will adjust their schedule, will push things around, because they know you're in acute pain and they want to help you. They will move things around, change, come in early, stay late, or see you over a lunch. The ones that won't, I think that's a, not a red flag, but a definite flag in my mind and say, are they there just for a job? Do they just go through the motions, or are they there to help me? Also, something to consider is the number of clinicians and professionals working at the place. So I think it's fair to ask, will I see the same clinician every time? Because sometimes in certain places, one person evaluates you and then you get passed on every time you come in, or not every time, but every 2 or 3 times you come in, it feels like you have to explain your story over and over again to the next person because they keep passing you on and on to different clinicians or different workers in the clinic. So if you're okay with that, that's fine. That's one model of clinic. But if you feel like you want to create a relationship with someone and you want the same person that you saw in the beginning to continue with you, that's another kind of clinic, and you should find one like that. All right, let's get into a little bit of the advanced imaging and scan type conversation. So it's very common that when you're injured, and we talked about this earlier, you will want to go to some kind of urgent care, primary care doctor, specialist, what have you. And like, well, I need to know what's going on. So because how can I fix something or treat something that we don't understand what's going on? So you feel like, okay, I need to get an X-ray, an MRI, something to solve this, or so I get more information. So in general, unless there is some kind of reason, like a specific or an acute trauma, you were in a car accident, you had a fall, there's certain red flags that when you're dealing and talking with your clinician, when they're evaluating you, these things are going off in their brain saying, okay, wait a minute, something's not adding up to a normal or predictable mechanical spine or joint or muscle issue, then yes, we'll help you get to the right scan to get more information. But that's actually in the minority. The vast majority of people that I didn't do anything, I woke up and I have I can't turn as well, or I have pain in my arm, or I bent over to pick something up and then my back hurt, and then over the course of a week to 2 weeks it started to get worse and down my leg. Those don't require, in general, do not require advanced imaging for us to start treatment. We may need it later if the way you're responding and the movements and the activities are not, like I said, are not adding up and you're not making quick improvement. Then that might be a good thing to get some more information. But in general, a good clinician, an expert in this field of what we do, should be able to accurately assess and diagnose that problem based off of the history, the words, and your story of how it happened, what makes you better, what makes you worse, certain movements, positions, time of day, all those things. And then you combine that with an objective test. That's why we have you move forward and move backwards and turn and test things and test muscle and different strength things. So be a little bit aware of a clinic or a place that says, no, we will not treat you, we will not even assess you without an X-ray first. Okay, in the absence of acute trauma, right? You didn't fall, you didn't have a car accident, you're 45 years old and all of a sudden your shoulder starts to hurt. You don't need an X-ray. That's limited information, and really the purpose of that is just so they can get that charge, that billable charge, because they should be able to figure a lot of stuff out without taking that. Now, if after the assessment something's not adding up, then you could do the X-ray. I'm talking about the places that will not even see you or help you until they have those higher level advanced scans, X-ray, MRI, CT scans. They won't even talk to you. It's not true. I'm like, you can help someone without those scans, okay? So just a little bit more on the advanced imaging. They're very powerful. They're very important. We do need them at times, but it's it's the minority of times, not the majority. Remember that an X-ray, an MRI, a CT scan, they're just a picture. In fact, they're just a picture in time. And the way you feel that day could be different than the way you felt, 2 weeks before the scan, or even 2 weeks after. So those scans are highly, especially the MRI, is highly sensitive, right? Very highly sensitive. It shows everything that's there, but it has very low specificity, meaning it can't show or prove, just looking at the picture, what's actually causing the pain. It's like taking a picture of a telephone. Okay, I see a telephone. I can tell it's what it is. It's there. Truthfully, it's there. I see it. But is it turned on? Does the battery even, is it dead? Is it ringing? Is a call coming in? Like all those things it cannot tell. So it can't tell if it's the actual source or cause. It's just one piece of information that the expert clinician needs to use, right, in the whole gathering of information to say, okay, based off of your story, based off of what we found with your repeated movements and exercises and activities and how you feel, this picture makes sense, it correlates. Or sometimes it doesn't. But who cares? Even if it doesn't correlate, and this has happened, people can say, well, I went in because I have this, back pain and leg pain, and the MRI looks pretty normal. You still have pain. Like, you still have something going on. Even if it doesn't show it, you know it's still there because you're still having an issue. And then the reverse can be true. There can be an image that looks terrible, like, it's all kinds of arthritic changes and degenerative this, joint, disc, whatever disease, all those fancy terms and words that really just do more fear. They do more to instill fear than they do to help a lot. It can actually be quite scary to learn and see all these things when really a lot of those things, depending on your age, depending on how much you've used, the arm, previous history, right? Surgeries, accidents, those things could be considered normal findings. Things that you would find in anybody that had that similar history, but they may have no pain. So like your right arm could hurt, take a picture of it, it's got all kinds of arthritic changes and all this stuff going on, rotator cuff tears. And your left arm could not hurt, right? No pain. Take the same picture over there, it could look the exact same. So they don't always correlate, and sometimes they do. I just wanted to give you a little bit more information on that. So as we close, thank you again for watching. Thank you again for taking the time to sit with me and listen, and I really hope that it was beneficial for you. I hope that you got information and knowledge gained out of this. You are a more informed consumer of the product. It's your body, it's your pain. You are in charge of who you see, who helps you, how many times they help you, the method and mode at which your treatment happens. And just remember that not all clinicians are the same, not all clinics are the same, and you may have to, try a couple of different places until you find the place that best, suits you and your personality, your injury or your pain. Some people are just better, and clinics are just better at treating other things than, like if I had a neurological issue, maybe I had a stroke and I have half of my, arm doesn't work, half of my leg doesn't work. I'm not going to go to a pediatric specialized, physical therapist because they work with kids. It's not what they do. I'm not going to go to an aquatic necessarily, like aquatic center, because that's not what they do. I'm going to go to someone who's, very specialized in neurological conditions. If I have a spine, muscle, joint pain, right? I have a mechanical pain where if I pick my arm up, it hurts. If I set it down, okay, that feels better. I reach a certain way that hurts behind my back, ouch, that hurts, and then I can get it to feel better. Again, for those, I'm not going to go to a neurological person, or I'm not going to go to an inpatient place that only deals in post-surgical, total knees and just gets people up and walks them around. That's not what they do. I'm going to go to a very specific, outpatient, orthopedic, skilled person that helps deal in and fix and helps me understand my mechanical pain. So call around, use this video as much as you need to for information. You can please ask these questions to places so that you feel like you are well informed and making the best decision possible for your health. Again, my name is Dr. Chris Erickson, owner of EHS, Physical Therapy and Chiropractic. Thank you.